and one thing when they sorry, where I did. Okay, age. Yeah, that na one
Yes,
of the
yes.
risk factor. So where you they stay, the race when you be, whether you be black, you be white, it is also a risk factor. So being a black, I think, yeah, being a black, it still give you, it increase your chances of coming down with hypertension. So your geographical environment, living in a low income country, if you increase that because of stress and all that. Yeah. Then when we come talk about modifiable, say things where we go fit change. We talk about our lifestyle. Those when they drink, those when they smoke, those when they live sedentary lifestyle, that is, they eat a lot of fatty diets, a lot of junks. And when you eat a lot of fatty diets and a lot of junks, you go increase the number of calories within your body, and cholesterol when go block your blood vessels, and those ones will come lead to atherosclerosis, wey go lead to when one of the side effect, one of the thing wey dey follow atherosclerosis na hypertension. Yeah, I be like say I don talk so many things now. So make I try
Mm.
break am down now. So you see that when we say sedentary lifestyle, that is the kind of life when people dey live. You know they do exercise, you dey eat a lot of junk food, fatty diet, many food wey contain oil, fat. eh and the person dey smoke, the person dey drink, e no dey do exercise. So those are sedentary lifestyles, and these are things wey we fit change. These are things wey we fit change. Stress na say another thing wey go fit cause hypertension. Lack of sleep, lack of sleep can increase the chance of coming down with hypertension. Now another of the non-modifiable risk factor na family history. So if your family, there's somebody in your family wey get hypertension, there's every tendency say you fit come down with hypertension. E no mean say na must say you must come down, e mean say you have that chance of coming down with hypertension. But when you fit monitor every other aspect of your life, you fit not come down with hypertension. So if you get, there's some conditions that affect the kidney, can also increase the your blood pressure. If it make person get hypertension, so if you get kidney issue, so one thing when they talk about kidney, means say hypertension fit affect the kidney. Also, the kidney fit affect your blood pressure. That is now two-way thing. So two of them they affect, go fit cause problem for each other. So these are just some few risk factors when I go mention. If Dr. Fred gets some, he can add to it.
Yes, thank you so much, Dr. Israel. Make I add one other thing wey fit make somebody get hypertension. Somebody fit get hormonal problem, if he get hormone issue, that hormone issue too fit give the person high blood pressure. We get many hormone for the body. So we get people if you get problem with hormone, thyroid hormone issue, if you carry their BP go up. Another thing if we give somebody high blood pressure, na some kind medicine where our people they drink. Get medicine where you go take now. This medicine too, if it puts you at risk to get high blood pressure. That is why we dey advise our people say, may you know they take medicines anyhow, because all these things fit put you at risk of getting high blood pressure. Now, if you get questions for us on high blood pressure, I beg wait. We go take your questions, but we won't come tell you now. Wetin come be the symptom if somebody get high blood pressure? How you go take know say, e be like say my blood pressure don high o, see o, the BP don dey go up. Wetin be the symptom? But before we continue again, abeg everybody, if you dey hear me, share this video, make people life dey safe. As we dey talk for here now, share this video, make more people come learn, make dem know about high blood pressure. So, Dr. Israel, may we just talk briefly about the symptoms of high blood pressure? Thank you.
Okay. All right. Thank you. Now, the signs and symptoms of high blood pressure. The first thing you need to know is high blood pressure is asymptomatic. When we say asymptomatic, it not get signs, it not get symptoms. So if signs and if e can't show you sign, you know say e don go for e don tey for body. Na make regular checkup is very very important. We always dey say at least for those wey no believe say dem get, at least once a month check your BP. Just check am, e no go do you anything. For some place sef dem no dey use money take check am, you just enter. If you go health centers, I don't think they will even collect money from your hand. Now when you go pharmacy or some private hospital, now if you collect money, but if you go to health center, they're not supposed to collect money from your hand to check your blood pressure. So asymptomatic, first thing you should know, because many people go don't come down with don't get hypertension and they don't know, they never even know, because e no dey show for face, e no get any signs, e no get any symptom. However, for some cases, some people fit come dey feel headache, headache. Maybe they do small thing, headache, they sleep, as they sleep, wake up, they still get the headache. They take pain relief to stop the headache, like the headache still dey there. So that kind of person, that one, headache na still na one sign of it. Another sign come fit be say some people go feel dey feel weakness in one part of their body. Dey feel weakness in one part of their body, like their one hand and one leg go dey weak somehow, or one hand alone or one leg go dey weak somehow. Or they say the way e dey weak, they no really understand. Just know say na stroke that person don almost dey get in that case. But it can still come out like that as signs and symptoms, as symptoms of high blood pressure. Some people will come down with full stroke, some can come down with unconsciousness or your fall. So these are not just a few signs and symptoms, because you don't really get serious signs and symptoms when you say, now this one I need to wait, make this one happen before I know say I don't get BP. No. So the
Mm,
best way to
mm.
know if you get, if you whether you get high blood pressure, now when you they check your blood pressure regularly, and they check am regularly, then you will be able to know. You go fit find that whether you get high blood pressure.
Yeah. Thank you, Dr. Israel. Make I add something as well. Now, e get some people, they go tell you, say, I dey know when my BP don dey high, because if my BP don dey high, e go dey give me sign for my head. I go dey feel am for my head, or I go dey feel am for my ear, or I go dey feel am for my eye, or I go dey feel am for my hand. Abeg, listen carefully. By the time you start to dey feel am for your head, abi your ear, abi your eye, e don dey cause you problem for your body. You are not supposed to wait. You're not supposed to sit down for house dey wait make e give you sign. Then na that time you come know say BP don go up. Because you get some people wey get BP and they go talk say, I no wan take my medicine, oh, I go dey monitor my body, oh. When e go up, e go give me sign for my head. E no good. And if you listen to wetin Dr. Israel talk, some people hand go come dey weak small small. Those people don dey near stroke. Now, if somebody get high blood pressure, now everybody will they give medicine, abi we no go give everybody medicine. Because I hear people go tell us, say, I hear say I beg go, and they say I get BP, I must take medicine. So make we talk about that one. Now, I beg, if you ask us any question, we no dey related to high blood pressure today, we no go read your question. Like, we no go comment about your question. No vex. Everything we will talk about today now only on high blood pressure. Is that okay? So, Dr. Israel, uh, let's talk about those people where we say they go dey talk, say, I beg go, I no go take my medicine because I hear say now only medicine we dey use for high blood pressure. May we break them down for them, I beg.
Okay, the treatment of hypertension, it can be medical and non-medical. Yeah, when we say medical, that is the use of medication, the use of drug. When we say non-medication, non-medical, it means say you do other things to take reduce your BP. However, I get where the BP go high reach. We know the whether you do other things, you must still take we must still start your medication. And another thing, before
Mm,
I will call the talk all those small small things continue, then BP no dey, there's nothing like my BP don cure, my high blood pressure don cure. High blood pressure no get cure. The more you continue taking your medication, the more the blood pressure go dey come down and go dey control. and very well. So we know the blood pressure, high blood pressure is not curable. We can only control it. We can only manage it. And so all those times when you go, some of us, your doctor go write drug for you for 1 week or 2 weeks, expecting you to come back. You take and finish. You say it don't cure. You continue your lifestyle like that. You're not to do yourself any good. You're not to do yourself any good. Now, then I go see make I first talk before I come talk another thing when I want to talk. Now, when we talk about the non-medical, it means say there are other things when you fit do to try reduce your blood pressure, to try reduce your blood pressure. And these are the risk factors. If you feel reduce everything we concerning your risk factor, then you can the modifiable risk factor, then you can actually reduce blood pressure to some extent. Now, if you dey drink, you reduce your drink. You dey smoke, you stop your smoking. You reduce salt intake. eh? Reduce salt intake. Reduce okay, yes, reduce salt intake. Oil, oil. Reduce fatty food and do exercise and reduce fatty food. That is fry. All those people where they like fry, they like junks, like spicy food. Reduce them to the barest minimum. Salt. When we say reduce salt, not mean say make you not put salt for food. Though. Still put your salt for food. But the one where they really works fast now, those people when they don't already put salt for food, they don't cook food finish. They constantly go carry extra salt, come they pour put. Now that na really
Mm.
no good. So reduce your salt intake, do exercise. For those wey don old, now mean say make you go dey carry weight. No, do simple exercise. Bricks walking, those are exercise that you can do. Dancing, those are simple exercise when you fit do. And those ones go still help to reduce your blood pressure. Eh? I don already talk about reduce fatty diet. I don talk about stop smoking, reduce your drinking, if possible, stop it. Alcohol take intake. That's what we now we dey talk about. If you fit do all those ones and your BP never fair high well, there's every tendency say you no go start medication. You fit not take medication, they go tell you say make you stop medication. But if you fit do all those ones and your BP never fair high well,
Waiting happen. Now only me, no they hear. Dr. Israel, be like say your network don't go down. So may I continue? I don't know what happened to Dr. Israel network. Now, waiting Dr. Israel talk, we say it gets some people, you get how their BP go just go up small. If you exercise, you reduce your weight, you reduce your salt, you stop to the smoke, you stop alcohol, your BP go come down to normal, because the BP never to go high. So not be everybody will just get high blood pressure and we they give medicine. But you get some people, you get where their blood pressure go reach, go they very high. Those people go need medicine to help them. Oh. But if your BP just go high a little bit, no doctor will carry medicine give you, say, make you can't drink medication for high blood pressure. That is why it go good, make your lifestyle they healthy. If you they take energy drink, if you they take all those caffeine too much, if you they chop processed food, shawarma, burger every time, you they chop fry, you they chop cheese, unhealthy fats, all these things will increase your risk to get high blood pressure. What you go do to help you eat healthy, exercise, move around, not just sit down for one place. Uh, no just sit down for one place. Can't talk say eh, I dey enjoy my life. No, you have to move your body. All those things will help you. Then you get how your BP go come high, go. All those exercise no go fit. You go need medication to support you to help you bring down the BP because the BP dey too high. And ordinary lifestyle like that no go fit bring them down for you. You dey follow me? Okay. Now make I take question here. Peace. May we take one question. It says, can high cholesterol cause high blood pressure? The answer is yes. High cholesterol, oh, e get some people, the cholesterol for their body, e don pass the normal range where e suppose to dey normal. E don go pass am, e don go high. And if e go high, that cholesterol, e fit dey inside their artery, their veins. And if e dey inside there, small small, e go come dey block the arteries. Blood go come dey use more force to waka pass your body. E fit carry your BP go up. So high cholesterol fit also increase your BP, make your BP go up. You dey follow me? Very good. Now, before I continue, abeg, share this video. Share. Everybody click on share. Now, Izu, they ask us question. He say, what do I do if my blood pressure is 160 over 100? If your blood pressure dey this level, wetin you supposed to do now? See your doctor. Make dem check you. Number one, try to find out wetin be those things wey fit cause your BP. Try, number one, try to find out. Number two, try to check if this BP don dey give you problem for body. Number two. Number three, then carry out some tests to know how far this thing dey. And then number four, they will come advise you wetin you go do to take bring this BP down. But you can't just sit down at home if you have a blood pressure of 160 over 100. This one na matter wey you need to discuss with your doctor. Okay. Now, if somebody can't get high blood pressure and the person no do anything, the person no know, the person no check him BP, the person just dey enjoy life, and the BP dey high for him body, dey go, dey chop am small small, wetin fit happen? Number one, that BP wey high, if he give the person stroke, you go just see somebody tell say, suddenly the person mouth don bend go one side, suddenly the person hand don weak, e no fit waka, e no fit talk, e fit cause am. Number two, e fit affect the person for eye, the person fit no see. So if somebody get high blood pressure and you no check am, you no know, you no follow your doctor advice, and your BP go up, number one, e fit give you stroke. Number two, e fit affect you for eye. Number three, e fit spoil the person heart. E fit come dey give the person heart small small problem, small small. E fit come enter heart failure. Number four, e fit come spoil the person kidney. You go hear see some people dey get kidney problem. The person kidney spoil, person kidney, hypertension, wey you no control, wey you no manage, wey you no take medication and other advice wey dem give you, high blood pressure fit cause am. You dey follow me, abi? Abeg, if you just dey come, please just listen. We don't start dey come since morning, so you just come now, they ask some kind of question wey we don already answer. So Dr. Israel, now may we add one or two things, and then we go take your questions. We go take your questions and break some things down for you. So may I bring Dr. Israel back on the live session, make he answer, and just continue from where I stop on that complication of high blood pressure. Dr. Israel, over to you.
Okay. My network went AWire before. So I think Dr. Fred don't talk so many of the complications. Complication not the finish when it comes to hypertension. I believe saying go don't talk the most easy, the most simplest, or the most commonest one, which is stroke. Stroke, a kidney failure, heart failure, and so on and so forth. You get everything fit happen in terms of hypertension. For the stroke, the blood vessels for the brain figure burst, and that is the artery and the vein. The figures rupture, scatter, pour blood for the brain. Or sometimes you go cause embolism. You make sure say some blood not dey flow past some place where then there will now become an occlusion. Yes, it will now become an occlusion. The something will come cut. One of those fat wey don go stay the blood pressure, the artery side, dem fit come remove, come go block some places, embolism. So many things fit happen when it come to hypertension. I believe all the one wey Dr. Fred don talk na the simple one and the easiest one wey we need to know, not be, so that we not going to talk too much. Move for not going to talk too much. Yeah. So
Okay.
I think I been dey talk the treatment. So medication still dey. Now, once when I want to talk about that medication, be this. I think I've said this. When you dey take your medication, abeg, if you can't go check your BP, they tell you say e low. E no mean say make you stop your medication. Because I dey hear say some healthcare workers go once you check your BP, say e low, they'll tell you say not take your BP medicine today. Funny enough, they never even know when last you took the BP medicine. So because once you take your BP medicine and you check your blood pressure, there's every time it should go down. The BP is supposed to go down, showing say the medicine wey you dey use dey work. If you not take am and e still go down, make you see doctor so that the doctor go know whether na to reduce the dose of that medication wey you dey take, or if na to tell you how you go come the new way wey you go come take dey take am. So not be say make you no your take am. They say not take am, go. And you now, you not take am that day, you no go come the next day, come recheck whether your BP still go up or you go down, you go just stay. After 1 week, you check am, the BP don dey heaven. You come say, na the nurse, na the healthcare worker, na say make I stop am. So please make sure you get the correct information before you think of reducing or stopping your medication. Make sure say na doctor na tell you, not be any other person. Say na doctor na tell you. Okay, Dr. Fred, hand over to you.
Yeah, thank you for that very important thing wey you talk, because I dey hear people too. My BP don't come down to normal. I don't stop my medicine. You can't stop. You know, go follow your doctor talk. You go can't travel. By the time you go know the BP don't fly, go back up, don't they cause problem. Now, may we take your questions. Many people don't get questions for us about high blood pressure. So we go try answer so many questions in the few minutes we get. But I beg, now beg I beg, I beg. Share this thing now. Share this thing, I beg. Make me people can learn. I beg, share. Okay, Dr. Israel, we get one question here. It says, can ulcer cause high blood pressure? Make we answer and sharply. Make we answer the questions quick.
Also not go cause high blood pressure. Also not go cause high blood pressure. The only thing is that when you get pain fit make your blood pressure increase, but it not mean say you get high blood pressure. As at that moment, your blood pressure fit just increase. If anything wey dey cause that pain don comot, your blood pressure fit come down to normal. So that will not be say you get high blood pressure. So also not go cause you high blood pressure.
Okay. Somebody says, I know someone who is not taking all those things you mentioned, but she has been diagnosed. Okay, that's not how to spell diagnose. She has been diagnosed of high blood pressure. Is it because she's not doing sports? My answer you, Mirabel. You did not listen to us from the beginning, Mirabel. You just enter when we don't they go far. That is why we beg you. They come early, I beg. We said it in the beginning. Against some people, you go check their body, you no go find wetin cause their BP because their own no essential primary. You no fit find the cause. No be say the person dey smoke. No be say the person dey take alcohol. No be say the person get am for family. Some people dey like that you can't find out. You understand? But if you listen to wetin we talk, wetin Dr. Israel talk, e get some kind things too where your friend go fit do, wey go also help am support in blood pressure. Furthermore, in addition, hope say na doctor na dey manage am. No be say your friend just go test him body for somewhere, the BP come high. That time, they just talk say your BP, you have high blood pressure. No, because if you follow us from the
They come
beginning,
enter pharmacy, go collect drug, go collect
they'll
medication.
come wrong. They will just check them once. Next thing they don't go wrong, go they buy medicine. No be so. This is why we they beg you. Say if you notice say this kind of thing they do you, your BP high, you go follow doctor talk. They go recheck you again to confirm true if the BP high. Okay, we get question here. In checking blood pressure, the systolic or diastolic pressure, which one is more to consider?
The
Pressure, I beg,
two, you
respond.
consider the two. You consider the two. You know, they look one, leave one. Yes, there's something when they call systolic hypertension. And when we say the systolic go just high, why did the diastolic go dey normal? And that one is known as systolic hypertension. So that's why you consider the two. You know, you go just look only one, leave one. So the two must be
Hmm.
normal before you say yes, this one a normal blood pressure.
Okay, before I go to the next question, and the people for YouTube, give this video thumbs up now, like this thing. Our people, I don't notice say most of us go just come this place, ask us question, and we can't go. No, they support us. Oh, yeah. Ah, God, they shall. I beg. Like this video if you dey learn. Share this video. I beg. Thank you. Now, Omola they ask us question. If I sleep, can sleep bring down my blood pressure without medication?
So sleep fit help you if it bring down your blood pressure, if your blood pressure is not very high before, and if you never first get hypertension
Hmm.
before. So somebody wey don get hypertension and it's already on medication, it don already get hypertension and he just need to take him medication. So only that if you
Hmm.
not first get hypertension, say maybe na stress or one thing that you do now make that BP get up, go up that moment. If you sleep, the blood pressure will come down because all your body system don relax as at that time. So sleep
Hmm.
alone
Hmm.
cannot just bring down your hypertension. If you get hypertension, you have to do other things what we don't mention before.
Okay. Now, you get some questions where you go ask us. The answer we don't talk on before, especially for people who just they come. I beg. So we got advise you, may you try go back when we end, watch from the beginning because some people will just come now and we no go fit answer other people. We follow from the beginning. Okay. This person says, does drinking hot water or warm water help to lower cholesterol in the blood, or does it help to lower high blood pressure?
Drinking warm, lukewarm water or hot water, as you said, does not have any business to do with high blood pressure or your cholesterol. You are just drinking water. And if you drink water, the water will just help your kidney and all that. And to show say your kidney is working fine. And that's what water does. So you can help reduce your blood pressure and all that. In fact, sometimes we were able to say too much of drinking water self even increase your blood pressure because it shows say a lot of salt dey your body now make you dey consume water, and that one will fit increase the blood pressure. But that aside, drinking too water, lukewarm water, whatever, does not have anything to do with your BP. It only they help to tell you to remove waste from your body, and they make your kidney they work well.
Make I add to that. I know say some people they do video on the internet. A lot of people want to say things that you will like so that you will follow them. But here we go talk am as e be, so that may you know verse. If you verse, we don't talk am. There is nowhere where you go drink hot water. Say the hot water will not enter your body and go and be melting the cholesterol and be melting the fats and then carry your BP down. My brother, na lie, yo. Na better lie. Anybody will tell you that one, that person is supposed to tap the head. The head will do come, because the person don't lie give you. Hmm? Okay. If the diastolic is always higher than the systolic, what might be the cause?
If it means say the blood pressure is not well controlled, and the medication when the person dey on is only controlling one of the entity of blood pressure. So you need to get medication that will help to regulate the two entity. Eh? That will help to
Hmm.
regulate both the systolic and the diastolic. But most
Hmm.
of the time, we dey quick get problem with the systolic, not even the diastolic.
Okay, we dey get plenty question on high blood pressure. Peace say is taking baby aspirin daily safe and help to avoid stroke. Hmm.
I don't know what is baby aspirin, but if you they talk about vasoprene, yeah, yes, taking that medication is okay. Yeah, normally they say they help the heart, and they help to make sure say blood not clot for the heart. Eh? But I will say advice. That drug is only good for that medication is only good for people when their BP they well controlled. Not be those when their BP they very high. So if your BP is very high, we know say it already get high tension when they move. So you constantly go to take drug where go make the blood they light to they move well. It means say you want you they cause more problem for yourself. So taking that medication now for those
Hmm.
when they already they control their BP very well and their BP is well controlled. So you cannot take that one to make sure say clots not form so that there will not be any occlusion anywhere in your body and to your heart as well.
In addition to that vasoprene, you cannot just go and buy it by yourself and drink because you get one video where I see for internet where somebody do the video talk say make everybody go buy vasoprene. You can be drinking the vasoprene make yourself go get bleeding inside your body. So you go need a doctor to guide you. Vasoprene no be vitamin C. Aspirin no be vitamin C or multivitamin. Now very powerful medicine. So you would need a medical professional to guide you and tell you how you go take them and when you go stop and many other things. So no be say you go just go buy and drink a bag. May you no go give yourself other problems because of the aspirin. Okay, now we have more questions. We go soon end it. I beg, doctor, can high blood pressure affect a person's heartbeat? Yes. Yes. How can hypertension be managed in aged people? Aged people. Dr. Israel, you want to respond quickly because of time?
In age people, when they check their hypertension and it's high, they should go and they should be on their medication. That's all. There's no many things. Be on your medication, reduce salt intake, do exercise. Now the same everybody, every whether old young, all of them get the same, almost the same management. There's nothing different. Hmm? If they're not fit do exercise, so far they be on their
Mm,
medication, that's fine.
yeah, and they go for their follow up, their regular checkup.
Yeah.
Very important because remember, remember what we said in the beginning that if somebody they take in medicine, normally the BP will come down to normal. But that does not mean you will now stop because it has come down to normal. Sometimes your doctor will need to reduce your dose. So if you dey take your medication, your BP is fine. You also need to discuss with your doctor. May they help you reduce them. This person says, my diastolic is always 100 or 95. What can be done?
Go and meet your doctor. You know what to do. And meet your doctor. If you don't have if you are not going to any hospital, you are not doing yourself any good. So go and meet a doctor. He will guide you and tell you what and what to do so that your diastolic will come down.
Yeah, okay. Let me say something, especially for those people who just they follow us, who just they see us. This program not to teach people. This program no be to dey prescribe medicine for people. Like if you have high blood pressure, go and buy calcium channel blockers, go and buy diuretics. We know they do one for here. We know we share medicine on this page. Our goal here now to teach you, make them easy for you to understand. So if you get any problem, you would need to go and discuss with your doctor, not social media. You understand? I beg. Okay. Now look at this question. Aspirin and atorvastatin, which one to take in blood pressure which the person having stroke?
I beg, go and see your doctor. This is how they measure all this medication. Two things involved. Either you they read or you na doctor, you wan try whether we know wetin we dey talk, or three, you are on many medications and so you have learnt all these names. But sorry, sorry to burst your bubbles. We for here, as Dr. Fred talk, we get wetin we know where our limit reach. uh, on social media, we get our limit on social media. E get wetin we dey talk and wetin we no dey talk for social media. So that kind of question, we will not say it in social
Mm.
media. We cannot even tell you that this is the one you should take. No, if I say something like that, it means I don't prescribe drug for you. The next thing now, which milligram now you can ask me with style. So please,
Uh,
in such in this kind of case, carry the two medication if you get them. Go and see your doctor, a cardiologist to be precise, or and a neurologist, a neurologist and a cardiologist. They will guide you and tell you which you will be taking, so that the person no go get stroke and everything will be fine.
mm. Yes, thank you very much, Dr. Israel. Florence, good evening. Now, you get some questions where we dey also see online. Some questions now to test you. Some people will come your page to test you to see whether you know what you they talk. So sometimes some kind of questions there like that we go just ignore because this program, and not be today we start. So when we talk, we know what we are talking about. So no vex. In case we refer you to your doctor, that is actually the best thing for you to do. Let me say we no one help you. The help where will they help you? Nah, this one nine will they give you. Now, Dr. Israel, our time is almost up. Maybe just do brief recap. We'll just talk one or two things where we don't talk from the beginning. And for those who just they come, I beg, and you go need to go back and watch the video from the beginning, because you came late. Dr. Israel, over to you.
Okay. We start by defining hypertension, and we say hypertension na abnormal blood pressure when you measure two different times, 6 hours apart. Like you measure am now, you check am now, e dey high. 6 hours later, after the person don rest, you check am, e still dey high. So you fit say this person don dey get hypertension. I will also say the normal blood pressure, traditionally we use 120/80 plus or minus 10. Yes, so it means say if you get 110/70, you are okay. 130/90, you are still down and pre-hypertension. However, you are still okay. It just means say make you dey check yourself well. So we go forward to say blood pressure, hypertension not really to get not get cause, but it get risk factor. And we also can let us know say hypertension can be divided, have different type. We have the essential, that is primary, secondary, essential or non-essential. And we even have the white coat hypertension. I would say essential now the one where we never know wetin dey cause am. And you check everywhere, we know they know wetin dey cause am. Why the non-essential we come talk say na those risk factor cover. All those things where they do what you not supposed to. Your lifestyle, drinking, smoking, eating of too much salt, alcohol, and all that. And because you talk to people wey no dey do exercise, family history, all those are risk factors for hypertension. Then apart from those one, we consider say we come still try to give you the signs and symptoms. And the first thing wey you need to know na be say you no get signs and symptoms. So if you don dey feel anything for hypertension, know say you don already go far. Na make you come dey feel whatever you dey feel. So if you never go far, you not suppose feel anything. Na make it's very good to always check your BP. And that's wetin we talk. So we come talk about treatment. Say treatment, once you start medication, continue. There is nothing like cure when it comes to hypertension. Hypertension no get cure. We dey only fit manage am, we dey only fit control am. And you no go start your medication, start am today. After you take am 1 week, you say you don cure, you can't stop am. No. Apart from
Ew, what happened, Dr. Israel? I know they hear you again. I love this recap where you they do. Walai, walai, walai. Okay, let me just say what he said. Ma continue.
I beg, ask if
Say
people they hear me.
okay, I dey hear you now. Continue, please.
Okay. So um that is then we want to find out you need to also stop your whatever you they do when you're not supposed to do. So those ones go help to take care of your hypertension. So we gonna talk about the complication, and we say complication go fit dey every part of the body, from the brain, from the head to the last part of the uh, body. Complication fit dey. So if it affect the brain, you cause stroke for some people. If it affect the heart, if it affect the eyes, if it affect your kidney, and so on and so forth. So if it give problem to all this part, now they make some people they get cardiac heart failure. Hypertension they cause that. Now, apart from the causes, we cause it. Okay, prevention. We don't already talk prevention are just your lifestyle modification. When you modify your lifestyle, you are using style to prevent hypertension. And if you know, say you know a person when your family get hypertension, you need to modify your lifestyle. You need to know what you they take and what you they do each day. And as we do all this one, we also answer questions, and we also try to clarify some things. And we also want us to know, say, know all these things to make you know peace. Because this one are all when I need to talk for now.
Thank you very much. Some people they watch us on Instagram. GMG, good evening. I see you on Instagram, and other people where they watch us for Instagram. So this program, and we stream them for Facebook Live, YouTube Live, and Instagram Live. This program now every Sunday by 8 p.m. Nigerian time. So if you come late, you don't miss, no vex. And we did very conscious of your time and our time. Thank you so much, Dr. Israel, for this thing. And you get one thing where we not talk about, that is hypertension in pregnancy, pregnancy-induced hypertension. Some women feel get pregnant and their BP feel come high. That is why we dey beg women. Say if you get belle, abeg o. They also go for antenatal o. Make dem dey check you, no just sit down for house. Because some women fit get high blood pressure when they get belle, and that high blood pressure fit affect the woman. It fit affect her pikin too. So your doctors will help you manage them, many things. And after you give birth, some women might be lucky, the BP fit come down. For some other women, the BP fit continue like that with them. So follow your doctor's advice. On this page, our job now to teach you. Our job now to make it simple for you to understand. And we know they here to share medicines for people. We know they do them. And one thing we know they do, we know they give people our number to call us because we are very busy. And we know they give number, say, I want to call you and talk to you so that you can tell me my problem, what I can do. If you want to do that one, you go pay for private talk. So no vex, carry your body, go hospital, make them check you, make them treat you, check your blood pressure, and follow all the advice where we don't break down for this page. Remember, I can always tell you, good life now waiting. Good life now waiting. Good life. Good life now sense. Thank you so much. We will see you again next week, Sunday, this same time. We will see you on this page. I beg, no come late, because if you come late, you go miss. So please, now 8 o'clock, come early so that we go follow you interact. Thank you and have a wonderful evening. Bye-bye, Dr. Israel. Thank you, and take care of yourself. Bye-bye.